survived a brain tumor, but if I had relied on my government for health care, I'd be dead. I am a Canadian citizen. And as my brain tumor got worse, my government healthcare system told me I had to wait 6 months to see a specialist. In 6 months, I would have died.
That is incredible. That warning is part of a new ad campaign predicting the perils of state-run health care. It is set to air in 8 states starting today. And critics of President Obama's health care plan here fear that government-run health care for some will turn into government-run health care for all, and that U.S. patients will end up in similar life-threatening predicaments. Our next guest is the woman from that ad and knows all too well the problems of that system. Shona Holmes joins us live from Toronto. Shona, good morning to you.
Good morning. Thank you very much for having me.
What an incredible story. Your doctor in Canada diagnoses a brain tumor because you were having vision problems. So you went in, you got checked out, they diagnosed the brain tumor, and after they know it's a brain tumor, they say you have to wait months before you can get to a neurologist?
This is exactly what happens, and unfortunately, I'm not just one story. There's so many out there like me.
And so when they told you were going to have to wait months before you could actually see a neurologist, you obviously said not acceptable, and you did what the only thing you could do, which was cross the border. Well, tell us what you did and what you found out when you got to the Mayo Clinic.
Well, this was very difficult for us to do because as Canadians, we're really not used to this. We get, you know, your primary care physician gets you into your specialists and off you go and see them. Unfortunately with us, we couldn't get me into anybody within an appropriate amount of time, and my vision was deteriorating rapidly. So suddenly I realized I needed to do something, and do something very quickly. I have a lot of American friends that just started telling me, go see another doctor. And that is something that we just aren't allowed to do here in Canada. So I phoned the Mayo Clinic, and fortunate for me, they were able to see me. I saw them very, very quickly, and within a week I had a full diagnosis as well as recommendation for treatment. And the thing that I find the most amazing about my whole situation is at that time they encouraged me to come home and have my surgery back in Canada. Which I did. I did come home, and again, I found the exact same thing. I was unable to get a surgeon that was able to do the surgery, and within 3 weeks, I was back in the United States and had the surgery.
And your Mayo Clinic doctor told you you needed surgery immediately, that you couldn't be listening to anybody in Canada telling you you had several months to spare.
That's right. That's right. And that, you know, my husband and I often talk about ignorance being bliss, because when you don't realize really how sick you are, it's very easy to just sort of go along with the flow. And at that point, what I decided I needed to do is I was standing there with a full diagnosis, and I needed somebody to listen to me. And it was a gamble that the Canadian government was prepared to take that I just, my family and I weren't. We weren't prepared to take.
It is incredible that you went back to Canada with the diagnosis from the Mayo Clinic in hand, saying this woman has a brain tumor and she needs immediate surgery, and still you couldn't get operated on within a timely manner. Now, thankfully, everything worked out for you. You were diagnosed with this Cushing syndrome. The tumor was removed, and you're okay, correct?
I am okay. But I think that an interesting aspect of the story is that the Mayo Clinic had also recommended another surgery at the same time, and 3 years later I just had that surgery a couple of months ago. So it took me 3 years to get a surgery that was recommended at the same time as the brain tumor removal.
In Canada. And the question I have for you, Sonia, is a lot of people here in America look up to the Canadian healthcare system and we think, it sounds great, it's free. You say it's not free and you're not getting your money's worth.
No, it's absolutely not free. We pay very dearly for it through our taxes. And anybody would have to think that health care costs a lot of money. We all know that. We know that from both sides of the border. It's not that we lack the talent. That there's absolutely, in fact, 2 of my doctors at the Mayo Clinic were Canadian doctors. And so the talent is here. We just don't have the funds, and we don't have the resources. We have hospitals closing. We have wait times, diagnostic wait times, surgery wait times are just absolutely horrendous, and they're hidden behind the fact that you wait 6, 7, 8, sometimes as much as a year to see a specialist, and then you're not officially diagnosed yet. Until you're in that office and the diagnostic testing is done, you're just nowhere.
Shona, I know you're very grateful to all the doctors who helped you, and we are very grateful that you took action and got yourself the help you need. All the best to you.
Thank you so much.
What a
for coming out
story.
with your story.